So good afternoon to all of you. Welcome to the Early Childhood Development in a Time of Pandemic webinar series. Today's topic is the impact of the pandemic on children. This webinar series is presented by Families Canada and the Centre of Excellence for Early Childhood Development. I am Zinda Saleh, I'm the CEO of Families Canada, and today's webinar will be facilitated by Isabelle Vinay, an expert in the prevention of disruptive behavior in the early years and Executive Director at the Centre of Excellence for Early Childhood Development. Today's webinar will highlight some possible effects of the pandemic on young children's behaviors and emotions. And we hope that today's webinar will be useful to you as you help children and their families through providing evidence-based information that is relevant and responsive to the current climate. We also hope to make it interactive and generate discussions around issues that are relevant to you. So do please participate after the presentation. Please note that today's session will be recorded. For now, we have muted everybody on the call, but in case you're not muted, please do mute yourselves. You can write your questions and comments using the chat button at the bottom of your screen. And if you have any technical questions, please feel free to message Bushra. She's our project officer and she's on standby and will do her best to help you out. If in the unfortunate circumstances we have any security breaches, we will end the call immediately. So I do apologize in advance should that happen. So this session is in English. If you would like to join the French webinar, you may leave the meeting now and register for the webinar that begins at 1:30 p.m. Eastern Time. And you can use the link that's provided in the chat box. And
oh, sorry, Zindu.
No.
Just wanted to say in French that la prochaine heure sera en anglais. Donc, si vous souhaitez participer au webinaire en français, on vous invite à quitter la réunion et vous inscrire au webinaire français qui aura lieu à 13h30 via le lien qui a été déposé dans la boîte de discussion.
Thank you, Christelle. And with that, we can officially begin. I'm very pleased to welcome our speaker today, Dr. Sylvana Côté. Dr. Sylvana Côté is a full-time professor at the School of Public Health at the University of Montreal and a researcher at Ste-Justine's Mother and Child Hospital. She heads the Observatory for Children's Education and Health and the research group on children's psychosocial maladjustment. Her work focuses on the prevention of three overlapping problems: psychosocial maladjustment, mental health problems, and academic difficulties. She has documented the conditions under which early childcare and education can foster children's healthy development and reduce social disparities. And she's identified programs to improve the quality of childcare services offered to disadvantaged populations. She has conducted her work while supported by national and international awards and honors, including Senior Fellowship from the Quebec Research Fund, Research Chairs in the Netherlands and France, and a Marie Curie International Fellowship. So with that very impressive background, I am very pleased to welcome you, Sylvana, and I will pass the floor to you now.
Thank you very much. Do you see my screen?
Yes, but you can put it in full screen, maybe.
Okay.
In presentation mode.
So, is it now in presentation mode? Not yet?
Not yet.
Okay. And now?
Yes, yes, that's
good.
fine.
And do you see yourself? Do you see yourself you see yourself?
Yes.
So I'm not sure how to stop that.
But we see you and we see the presentation in full screen now.
But you see yourself also, right?
Just in the regular Zoom screen. So I think
okay,
you're
good.
okay. Yeah.
Okay, good. Okay, excellent. Okay, thank you. So thank you for this invitation. What I would like to do is do a formal presentation with some slides, because I present data and it's very useful to see graphically the results of the research that has been conducted to date on the impact of the pandemic on children's development. So for that reason, I'm going to use some slides, but I'm going to try to stop early enough so that Isabelle and I can chat about the results and interact with all of you about the questions that you may have, because the results may bring about several questions that we will want to exchange about more informally. So let's start with, so the title is The Impact of Pandemic Disruption on Young Children. What environments will promote resiliency? So the first question we want to ask ourselves when we think about the impact of the pandemic on children is what kind of stress families experience during the pandemic? Because the pandemic in itself is sort of an empty variable, right? It's you know, lots of disruptions happen, but they varied. The extent to which families and children in particular suffered from the pandemic varies in a wide range of ways. And so we want to remind ourselves of the types of stress that have an impact on children's development to really appraise appropriately the situation. So first of all, there is this notion in child development, which is very central to human development, that no stress is not possible. Humans need to experience stress to develop their capacities to cope with life. And so there is one type of stress that is positive. It doesn't mean that it's comfortable or even fun to experience. They may be very difficult situations, but they are necessary to develop skills, move forward. So there is the normal and essential stress for healthy development. For instance, children who are separated from their parents for the first time when they go to childcare. This is a very stressful experience for parents and children, but it's considered a positive stress in the sense that it helps to develop coping skills. There is then the next level, which is tolerable stress. And here we think about more serious and lasting difficulties that may even involve a long disease or the loss of someone we cherish. That is tolerable, part of normal development, normal human life, and that for children may not be harmful if there is adequate, warm support from an adult. And then there is toxic stress, which is strong adversity, such as abuse, neglect. We could say not normal stress at all, that is frequent or prolonged, and that is experienced by children without adult support. So as you can see in the two types of stress, which are more difficult, more intense, social support makes the difference in the way children experience these stress, and thus the important role of the community to support children. There are lots of worries about the impact of the pandemic on children, especially the impact of school closures, the impact of childcare closures. And overall, we can say that although the data is just becoming available, we do not expect major rises in psychopathology among children. What is expected is more along the lines of increased social disparities, which I will talk about at length here in this presentation, and also the fact that most children are resilient. And so we expect around 3/4 of children to move along and develop normally without much difficulties. That doesn't mean that many children didn't have transient difficulties. But in the long term, we do not expect this experience to have severe psychopathological consequences on most children. Yet there are estimates vary, but around 15–20% of children and youth who are expected to have more severe problems, and then 3–4% are expected to develop more severe and problems that are in the clinical range. So what as a society do we worry about in terms of the impact of the pandemic on children? Well, we can say that we do not spend a lot of our time worrying about the disease itself, first of all, because in children it's been mild overall, and for children who had more severe manifestation of COVID-19, few were hospitalized. So here you have the total number of hospitalization in the province of Quebec during the pandemic, and we see that for children 0 to 9, they account for 2.3% of all hospitalizations. So the bulk of hospitalizations were among people 80 to 90, even more, more than half were for people 70 to 90. So very few hospitalizations for children. But I want to show you a striking statistic which puzzles many people. And this is the rate of hospitalization for children 0 to 9 according to socioeconomic status. So children from the poorest segment of the population were much more likely to be hospitalized than children from the richest or the middle class families. So this is a bit puzzling because these statistics control for comorbidities. So it cannot be accounted for by the highest possible rates of health problems among low socioeconomic children. So it's probably more related to the way that the clinicians handled the case at the hospital, taking more care of children who maybe were from families whom they felt could not provide adequate care at home. So this is the hypothesis that medical doctors are giving for this result. Now, most importantly, the impact of the pandemic vary as a function of the family environment, and this is even true for the virus itself. And it's very true for the other aspects of the impact of the pandemic, to which I will talk about, which are healthy lifestyles, mental health, and learning. So here we have, in terms of learning, the first aspect of that is impacted by the pandemic for children. We have the number of days that schools were closed in Canada and the world. And what we see on this slide is that in some provinces of Canada, the rates of school closure, at least for the first year of the pandemic, because we're still computing the second school year, were very low in some provinces, especially in Quebec. This was, in fact, the main public health measure for children that was taken in the province, which was to not close schools as much as possible, even though the situation was very, very scary in terms of infections. The governments insisted on keeping schools open. Then we have other provinces which did pretty well, also with less than 100 days of school closures for the first year, the first school year of the pandemic. And then we can see how some countries really did not manage to keep schools open. And so in terms of social inequalities on a global scale, we will probably need to monitor closely what is going on in those countries which are less resourced and did not manage to keep schools open for long periods during the pandemic. We hear a lot about the fact that emergency rooms were filled with youth who had mental health problems. And here on this figure, we see that indeed it's not only anecdotal. The rates of consultation for mental health problems in emergency rooms in hospitals, this is from Quebec, but it's coherent with other reports in other provinces, that the rates of consultation for mental health increased substantially. So during the first year of the pandemic, if we look at meta-analysis, so in 29 studies with covering mental health problems among more than 80,000 between the 29 studies, 80,000 children, we see that the levels of clinically high depression reach 25% and anxiety 20%, which these estimates are roughly double what they were prior to the pandemic. But it's very important to say the following. In high quality studies, 12% of children reported clinically high levels of depression and anxiety. So it's less than half. In high quality studies, less than half the estimates, the rates of anxiety and depression are less than half the estimates of bad studies. So this is something important to remember when we listen to the news, when we read the newspaper, and we have many information about the high rates of mental health problems. The quality of the data at this point is not always good. So we really need to be careful and remind ourselves that high quality studies cut in half the estimates for clinical problems that we may hear about. So this slide is from a very large study which estimated the global prevalence and burden of depressive and anxiety disorders in 204 countries and territories in 2020. And they wanted to estimate the change in the burden counted in years lived with disability following the pandemic. And so what you see here, the first rectangle, is the burden for anxiety and depression among women aged 20 to 39. And the lower rectangle is the burden for youths. So what we see really is that in terms of anxiety and depression, for young children, this is not what we should worry about most. We should worry about anxiety and depression, but for women of childbearing age, which are the mothers of our young children, which are the pregnant women also. And as we see here that the increase in anxiety and depression, the burden of the disorders for this segment of the population is the highest of all age groups, and that females are more affected than males. So this is something to remember when we speak with our families. Now, what is of concern, if I can say it like that, or what we should monitor closely in terms of impact of the pandemic for young children are the impact on learning. So we don't have a lot of data for preschool children, as most of them are not in school. The data on daycare is not as systematic as the data we may have in schools. But we can get an estimate of the impact of the pandemic on learning when we look at data for school-age children. And what we see here is that children who had learning difficulties before the pandemic, well, they had greater learning loss than children who were doing well here at this end of the distribution. In fact, there is almost no impact for children who were doing well prior to the pandemic. The impact in this study, large study in England, the impact is limited or concentrated on children who were doing not so well in terms of learning. It's also important to see that the learning losses are not homogeneous. They're not equal across the board. So for low poverty schools, for low poverty schools, the learning losses are small, like 2-3 percentiles in terms of reading, but much higher in high poverty schools. So between 4 and 11 point percentile, which is becoming substantial. And in maths, the learning losses are, we can say, light to moderate for low poverty schools and 3 times more important for high poverty schools. So in this large study conducted in the United States, we will have Canadian data soon, but not yet. We see that the learning losses are 3 times more important in high poverty schools compared to low poverty schools. And this slide shows the learning losses for preschool children this time. So it's very rare that we have data for preschool children, but in this study we do. And we see that there are, between 2010 and 2018, the scores on early learning, verbal development, non-verbal development are quite consistent, but that there is a drop in 2020 and 2021 among preschool children. So we would not be surprised to see preschool children start kindergarten with some delays more important than usual, and to see socioeconomic variations being the gap between low income and high income children to be larger than usual. In terms of lifestyle, there has been, it's not only anecdotal, there has been increases in screen time use. And studies vary. Again, for preschool children, the data is very rare. So I use data from older children, ages 5 to 12 approximately. And studies vary, but estimate 1 to 3 hours increase in screen time use for leisure, not for schooling, for leisure since 2020, since March 2020. There's been also reduction in physical activity. Many structures activities have been interrupted. School was interrupted for several days, so this impacted the level of physical activity, of course. And there is an American study documenting weight gain of 2.3 kilograms more than pre-pandemic years. So among children 5 to 15 years. So increases in obesity of 8.7%. So in sum, there is impact on the short term, but the most important question is, will there be impact in the long term? And for this, we do not have answers yet. It will be very important for researchers to work on this. And for researchers to work on this, we need public support, because it's not a given that people will want to monitor the impact of the pandemic on the long term. It will be very important, however, to see who has consequences and how we can, and the impact of our actions, the actions that we are putting together right now to mitigate the impact, whether they are in fact effective, and what else we can do if what we do now is not effective. The impacts are differentiated by age group. So for younger children, again, we don't have a lot of data, but of course, in terms of anxiety and depression, that's not the group most at risk. Their mothers, however, are at risk. And children are more at risk for learning delays. So stimulation will be very important. Stimulation, warm environments, using early childcare and learning services. And the impacts are very differentiated by socioeconomic status. So this was the hypothesis, and the data confirm that this is the case. So how can we foster resilience? Well, I will not teach you anything with this figure, but I want to remind everyone of the importance of the early years. As you know, the brain's ability to change in response to experience declines drastically over the first years of life. These on the x-axis are the ages between 2 and 10, and the amount of effort required to change one's behavior increases proportionally to the capacity of change, inversely disproportionately. And so we should remind ourselves of this every day, so that when people tend to say, oh, children are resilient and they will get through it without much help, and we should care about older children, well, we need to remind ourselves that young children, even though they are not the ones who are answering surveys and saying that they are suffering, they need our attention in these times. This is the time when their brain develops, and if they lacked stimulation, or they were more exposed to a very adverse environments during the past 2 years, it is now time to support them. So what's going on in a child's brain during the early phase of life are rapid processes of synapsogenesis, where the neurons connect together, and the connections that are made are highly dependent on the environment. In fact, they're completely dependent on the environment. Some experiments have been done. The stimulation that they receive will strengthen some connections, and others will disappear. So the quality, the intensity, the warmness of the environment will shape the brain. That the connections that are developed in early childhood are the foundations of what will be going on later in life. There are also, in terms of brain development, connections between the different areas of the brain, especially that with behavioral control, which is a very important connection to ensure the child's self-control and capacity to live in society, to behave in a group, to behave well. So all these connections develop during the life course, but the development is extremely rapid and extremely important during the first years of life. In terms of, this is why we suggest that public investment should be more coherent to the shape or the sequence of brain growth. So what we see here is that the public investment, public spending on youth between age 1 and 18 increases as children become older, while we suggest that we should focus more on these early years in terms of public spending to make sure that we profit from this brain growth. And I am sure you know Jim Exman's curve about the importance of investing very early in life in order to get a good return on investment. And so the prenatal period is very important. It builds the foundation for what will be going on in early childhood, in preschool, and in school-age children. There is also lots of evidence that investments provide a higher return on investment for when we invest in children from low socioeconomic background as compared to children who are not from low socioeconomic background. And more specifically, what we propose is that we use this pyramid, which is a classic, of course, in terms of post-pandemic recovery, that we remind ourselves of the importance of health promotion for everyone, which includes promotion of healthy lifestyle and promotion of early education, high quality early education, and also the preventive measures that can be put in place for children who are at risk, either in terms of personal risk or in terms of socioeconomic risk. What we do not want to do is psychopathologize the situation. So most children should be resilient and do well with a little support, perhaps sometimes more intensive support. But we want to be careful, especially in early childhood, to label children, to be alarmist with regard to the situation. There is one major developmental goal that should be put forth in the context of the pandemic, which is to provide good quality preschool environment for all and facilitate access for children from vulnerable families. So this is a developmental goal proposed by the United Nations, and which is that by 2030, we want to ensure that all girls and boys have access to quality early childhood development and care and preschool education that prepares them for primary school. And this is a universal global goal. So I very much hope that we will be able to do this in Canada, because we're well positioned, we're a rich country to be able to do this. What is high quality early childhood education? Well, it is an environment that is warm and caring, that is sensitive to children's emotion. So that provides care that is individualized, that is attentive, sensitive, that is flexible to children's needs, that ensures liaison with the parents, with the family, even with families that may be a little bit more remote from the early education environment, and that is provided with regularity and intensity. So all studies showing impact of early childhood education insist on the regularity and intensity. Intensity means normal hours, not 60 hours, not 50 hours, but 20 to 35 hours to 40 hours per week. But regular services, a structured environment in which children will be able to develop and to develop a trusting bond with educators. And I want to end with a reminder of the guidelines for healthy lifestyle, because as I showed previously, healthy lifestyle, healthy habits have been a challenge to maintain for everyone, and especially for families with young children. Most people are not aware of the basic guidelines for healthy lifestyles, so it's a good time to remind ourselves of what they are. Not to put pressure on people or on families, but to have guidelines of what we should keep in mind in terms of what's healthy. So for infants, physical activity is recommended for at least 30 minutes per day. And screen time for infants, so under age 1, is not recommended at all. And the recommendations that I'm presenting here are those put forward by the World Health Organization, the Public Health Agency of Canada, and the Canadian Pediatric Society. For sleep, we want our infants to sleep from 14 to 17 hours per night. It is not, of course, always possible. It depends on the child, but really that as rules of thumbs, this is what we should have in mind. For children 1 to 2 years, physical activity is recommended for at least 180 minutes per day. So these involve various activities. It involves moving. Basically for at least 180 minutes per day. No screen time before age 2. That's the recommendation from the Canadian Pediatric Society. And sleep for 11 to 14 hours per night. Then physical activity is at least 180 minutes as well for 3 to 4-year-old children. Screen time is at 60 minutes maximum for 3 to 4 years old, and sleep 10 to 13 hours. And then just to give you an idea, for children 5 to 13 years, we want at least 60 minutes of physical activity per day, which is a challenge given that for many children, they do not get the 60 minutes in school. So, which makes some pressure on after-school care or on families to do more with children if they want to their children to move enough. Then screen time is no more than 120 minutes, and some people will say this is huge. Some people will say this is too little. This is screen time for leisure, and it's no more than 122 minutes, and it's the age range is wide, as you can see, 5 to 13 years. Sleep from 9 to 11 hours. Now, we may want also to offer mental health preventive services for pregnant women and their partner at risk. So we do this with one program that we are implementing now at Ste-Justine's Hospital. The program is called Trois mois bébé in French, Parents and Babies in English. It's a program where we offer remote mental health support to pregnant women who are at risk of depression. So we want to target this age group that has suffered and is continuing to have a high burden from the pandemic disruption, to provide some support despite the restrictions that make it more difficult to have one-on-one contact, we provide a program which is based on cognitive behavioral therapy and phone calls. So we provide social support via phone calls to mothers who are at risk of depression. And the idea is to support women during pregnancy and up until 3 months after birth to foster well-being. And the notion is a notion that is important for all parents, which is for parents to take care of themselves in order to be able to take care of their children. So the analogy to the oxygen mask is the one we use in this program. So put your oxygen mask first, take care of yourself. We provide all kinds of skills to do this, and then you will be able to parent your child in a calm and sensitive manner. So the key messages: we need to rebuild the village around the child. Children grow up in communities. They grow up with lots of people around them, a variety of individuals. And during the pandemic, for many, the social network has been very much restrained. So we want to rebuild this network around the child. The impact of the pandemic vary depending on family socioeconomic environment, which is really just a marker for other things, for in some cases, the quality of the relationship with the child, but not always. That delays in learning are more important for children from socioeconomically disadvantaged families than for others. And so we need to offer support to these families, and we need to start very, very early to take advantage of the tremendous brain growth that is going on prior to, well, I should say in the early years of life. Thank you for your attention.
Well, thank you, Sylvana. I think your presentation is so timely, as there's so much information out about the impact of the pandemic, and it's hard. Well, it's hard for me to to know what's the good information, what is really science-based. So I really appreciated that you presented what we know and what we don't know yet, right, in terms of the impact. And of course, I have plenty of questions, and I think our participants have too. But one that comes in mind, from a service provider's perspective, being able to reach out to those families that you described, maybe some children from more disadvantaged neighborhoods, there's more impact on them. So, from those centers where we can reach out to those families, what would be a priority for you in terms of support that we provide to those families?
So, I think one game changer that can be offered to some children who grew up in families who may not be able to provide the stimulation that may be required to develop at one's full potential. I think one game changer is access to a high quality early childcare education service. It's not, so I think we need to change the view that preschool or early education childcare services is for parents who work, because it's much more than that. It's the village around the child. It's very difficult for single parents or for parents to give their children, and I'm talking about children between age 1 to 5, let's say, to give the richness of the environment that can be obtained by going to a high quality childcare service. It's difficult because it requires to to be an educator, and not everyone is an educator. It also requires to be selfless, which is very, very difficult to be full-time. Early childcare and education of high quality can provide a respite to parents, and we've shown in several publications and there is data from all over the world about this, that children from socioeconomically disadvantaged families benefit from using these services more so than the others. So for most children, it doesn't make such a big difference, but for disadvantaged children, it can be a game changer. And so to facilitate the transition or the use of these services is, I think, one priority. Well, now the institutions have to do their job, right? I mean, they have to set up, they have to provide the structure that Canadians need to be able to for service providers to do this liaison. There is a shortage of spaces, but there are special programs for disadvantaged families that may facilitate the use of these services. It's very often very difficult to navigate the system, very challenging to find a space. So I think if mechanism can be put in place to do the liaison, and then to ensure that the child is well in the environment, that the parents are well with the environment, that's a huge piece of work that could that I think would make a difference.
And Sylvana, if I may, and after I want to leave the participants ask their questions, but if I may, you know, in terms of quality, I don't know if you did it on purpose, but you know, amongst all the criteria of quality, you know, process quality and structural quality, you chose to present those about environment that are providing warm comfort to children. And you presented that even though you said we should not be that much worried about anxiety or depression in young children, more about learning, but yet you presented those criteria around being solutions, right, for stimulation. Did you do that on purpose?
Well, the environment needs to be caring, warm, sensitive, and trusting for children to learn. And we're not talking about learning letters or learning colors, or, you know, we're talking about learning to be well with others. We're talking about learning social skills. We're talking about communication, learning communication. You know, people focus a lot on language, number of words, but even more important than number of words is communication. Can you communicate your needs? Can you assert yourself with words instead of behaviors? And this can only be done in a warm, trustful, relaxed, flexible environment.
Well, I think it's empowering. And I thank you, Sylvana, because it's saying, well, let's pursue what we already do, provide those environments. And it's all about that caring and trying to do as much as we can in the context where there's so many challenges. But still, you bring us back to that priority. It's all about relationship and trusting relationships. So I thank you for that, Sylvana.
Completely. I mean, I think if people express so much distress about this pandemic, it's because social support has been interrupted and somewhat sometimes destroyed. And this is one of the hardest things that humans can go through, using their social network.
Thank you.
Thank you so much. Very useful, thought-provoking insights, I would say, and very timely. I know that, you know, as you said in the beginning, the data is still coming in, but this really helps, I think, answer some questions that have been coming to mind in our sector, especially as people who deal with families on a daily basis. And thank you to you, Sylvana, for the presentation, and to you and Isabel for some good discussion afterwards. I'd like to invite participants, if you have any questions for the presenters, please feel free either to raise your hand using the button at the bottom, or just put your questions or comments in the chat box, and we do have some minutes to have a discussion or to answer any questions. I can see some comments came in expressing the frustration around, what is lacking. And definitely in light of this data, I think people would want to do a lot more. But of course, it's not always in our hands with the resources at hand. Very limited capacity. People are working full out. We know, we've heard from our members across the country about what just the bandwidth needed to deal with everything. So
I think there was a question from Brenda. Brenda, did you have your hand up?
Yes, I was just commenting in chat that knowing how important these early years of child development are in creating that environment of trust and safety and stimulation for our little kiddos. The frustrating part comes back to the funding, and funding for quality staff that are both trained and have the patience and skill set for these little duffers is such a frustrating part of the work that we do. And so it's back to money, and that is just so frustrating when you see the impact at this stage that impacts these kiddos for a lifetime. It's just, I could pull my hair out.
Yes, I completely understand. So the training of the workforce and the valorisation, I don't know how to translate this word, but the profession of early childhood educators is not valued as it should be. It should be valued as much as elementary school or university or graduate studies professors. I think the role of an early childhood educator is probably more important than the role of a university professor, because you deal with adults when you're at university. People are autonomous. You're not building their sense of trust in the world. So, I mean, the fact that we invest in universities, I'm not sure we invest more in graduate studies than in elementary school, because there is a lot of investment in elementary school, but we should start all these investments much earlier. Value the profession, give appropriate salaries, give appropriate recognition. The Quebec educators have been going on strike. We applaud it. You know, they got a lot of what they wanted. This is the way to go. We need to raise the status of the profession so that people go to this profession because it's important and they want to make a difference in people's life. So that's key. And of course, lobbying for this kind of investment is crucial, because especially given the pandemic, you know, there's been a lot of attention with the elderly, for instance. There are huge problems with you know, elderly homes, and there are huge problems everywhere, the healthcare system. But if we do not manifest ourselves at this time, we will be forgotten, because some people are screaming very, very loudly, and the argument that children will that things will go by themselves for young children is not one that should be defendable at this point in time.
And I think it's important we bring in men, we attract men into this field as well, because our children, boys and girls, need to see the role models of women and men. And there is no balance in that either. But I thank you very much for your information.
I completely agree with you.
Thank you. We do have time for maybe one more, and I do see a question in the chat box from Jessica Forbes about the piece around depression and anxiety affecting or manifesting itself most in the perinatal period. And she asks, how do we account for this as we are supporting families, but dealing with concerns for our staff and ourselves, who are these women themselves?
So the prevalence of perinatal depression, so depression during pregnancy and the early postpartum period, is very high, and it was on the rise during confinements. So we don't, during confinements, everything was disrupted, and the stats that we get from confinements are not stable, so that's why we need monitoring in the long term. But as far as we could see during confinements and the intensive public health measures, women who were pregnant reported more anxiety and depression. So was it transitory? That's what we need to check. But even then, there was, before the pandemic, lots of concern about mental health during the prenatal period. There is, at least in the province I'm in, which is Quebec, very little resources. If you're not doing well during your pregnancy, if you have a very severe psychiatric problem, you will get help. But if you have something in between and you suffer, you would deserve treatment, but it's not urgent, you won't get much. So we this is another issue that is part of the continuum for early child development, for fostering healthy child development in the early years. If the mother is unwell at the birth of the child in the first year, and she and her partner care for the child, there is lots of studies, in fact 15 meta-analyses showing that it can have an impact. And that providing support can mitigate the impact. So there are solutions. There's just not a lot of resources for this, like there is not a lot of resources for education, care and education in the first 5 years of life. So the program that we propose is something that has been done in other provinces in terms of research, never in our province. And it is to provide help. It can be a new model of care. It can be social support that is less intensive than one-on-one therapy, which is not sustainable at the population level. Even though psychologists are very important. I'm a psychologist, but it's not sustainable to have everyone who wants a psychologist see a psychologist. So we need other models of care that will provide expertise, that will bring the expertise to the community without being so resource intensive and cost intensive. So this is why these kinds of programs are promising. We're doing a randomized control trial right now to test the efficacy, and we hope we'll see how it works. But we know that in other provinces, it's a model that has the potential to be deployed more broadly and provide at least some support, and also at least some contact with resources from the community to make sure nobody falls in between the cracks.
Thank you so much. I'm afraid we are at the end of our time. There are lots of good questions and comments in the chat box. We will take note of that, and that will help us also to figure out how we can hopefully develop some resources or webinars in the future around that. But yes, thank you so much, Sylvana, for your great presentation, and for the participants for being here, and Isabel for facilitating the discussion.